and welcome to the last Diabetes Connections in the News episode of 2023. I'm Stacey Sims, and every other Friday, I bring you a short episode with the top diabetes stories and headlines happening now. In the News is brought to you by Edgepark. Simplify your diabetes journey with Edgepark. Our top story this week, you often hear people say food is medicine, but an intensive program trying to show that's the case did not improve glycemic control in adults with type 2 any better than usual care. This was a randomized clinical trial. After 6 months, both groups had a similar drop in A1C, 1.5 among program enrollees, 1.3 for those with the usual care. No significant differences in other metabolic lab values between the groups either, things like cholesterol and blood pressure. The food as medicine group even gained a little bit of weight. This was a very intensive program. They built brick and mortar clinics. They had a dietitian, nurse, community health worker, weekly food pickup for 10 meals per week for the entire family, and the participants spent a year in the program. The control group was given a list of local food bank locations, and they did have the option to join the food as medicine group after 6 months. This was a study of 465 adults. They all had type 2. They all had an A1C of 8% or higher. They were also self-reported as food insecure. These researchers say that even though it didn't work out the way they thought, they hope, quote, it should not be overinterpreted. Had they thought, it should not be, quote, overinterpreted. And they point out there's very little study, much less clinical trial level study on this type of thing. They say they hope it spurs more research to find methods that will have a larger impact. Staying on food, and new information about moderate low-carb diets for people with type 1. This was a European study, largest of its kind to date. They had people enrolled with a 50% carb diet and a moderate low-carb diet, 30% from carbs. People on the moderate low-carb diet were found to spend more time in target range. The increase was about 68 minutes per day compared to the traditional diet. The elevated value, that time was reduced by 85 minutes per day, and these researchers saw no evidence of adverse effects. New study identifying an enzyme that blocks insulin produced in the body. These researchers saying it could provide a new target to treat diabetes. This was published in the journal Cell, and it focuses on nitric oxide. This is a compound that dilates blood vessels and fights infection, stimulates the release of hormones. It has a lot of functions. And these researchers say a novel carrier enzyme attaches nitric oxide to proteins, including the receptor for insulin action. So the next step could be to develop medications against the enzyme. Early days, a lot more to come here. The FDA is warning consumers not to use counterfeit versions of Ozempic. We have talked about this before, but the FDA says it has now seized thousands of units, but some may still be available for purchase. The needles are counterfeit. Their sterility cannot be confirmed, so there's an additional risk of infection for patients. They're not even sure what the medication inside really is. There is a lot number and serial number that you can check, and your pharmacy should be checking as well. I'm going to put both the lot number and serial number in the show notes, along with the way to report it. There is a website, so please check that out if you have any concerns. New research indicates that inflammation in the gut may predict how well a person responds to Tzield. That's the medication approved earlier this year to delay the onset of type 1. These findings are reported in the journal Science Translational Medicine, and it looks at how gut microbes can shape the progression of type 1 diabetes. The hope here is that clinicians may better pinpoint patients who are most likely to respond to Tzield. And since that approval, experts are advocating for universal screening for type 1 diabetes. They say at least 85% of people who are newly diagnosed do not have a family history of diabetes, and there are a few different ways now to test for the autoantibodies. There's TrialNet, JDRF has T1D Detect, which is a lot less expensive, and you can do it at home. The 2024 American Diabetes Association Standards of Care recommends more intensive monitoring for the progression of preclinical type 1 diabetes. We'll see where this goes. Right back to the news in just a minute, but first, Diabetes Connections in the News is supported by Edgepark. Edgepark is here to support you on your health journey. Discover convenience and peace of mind with Edgepark, your trusted supplier in diabetes management supplies. Edgepark has a wide variety of pump and CGM solutions from top brands to fit your unique needs. Plus, Edgepark works with most insurance companies and handles the paperwork to navigate insurance complexities for you and make the ordering process as seamless as possible. You work hard to manage your diabetes. Let Edgepark take care of the rest. Go to diabetes-connections.com and click on the Edgepark logo. Back to the news now, and quick mention of My Cause, My Cleats. This is the campaign where the NFL allows players to wear custom-painted cleats during selected games to raise awareness and funds for charitable causes. There are a bunch of players who either have type 1 or have relatives with type 1 who are singling out JDRF. These include Mark Andrews of the Ravens, Blake Ferguson, the Miami Dolphins, Chad Muma of Jacksonville Jaguars, and a few others. The My Cause, My Cleats campaign has been around since 2016. And before I let you go, there are a couple of really good articles taking a look back at 2023 and a lot of the technology advances and research and medical breakthroughs that happened in diabetes. I will link those up in the show notes as well. And coming up next week on Diabetes Connections, we're going to be talking about some of the stuff that happened in 2023, but mostly looking ahead to what we are hopeful for in 2024. I had a great conversation with Gary Shiner, the author of Think Like a Pancreas, and he does so much more. But we talked about, what do we think is going to happen this year? What are we looking forward to? What's important to the community? This was a fun conversation. Gary has a great sense of humor as well. On the Type 2 show on Diabetes Connections Type 2, we are starting out the year looking at the mental side of type 2 diabetes with the amazing Dr. Bill Polonsky. I am so excited to introduce him to all of these new listeners in the type 2 community. We'll be talking about diabetes distress, how that is real, what you can do about it, and he's a great calming presence, but he's also really funny. And, he knows what he's talking about. He's a great guy. That's it for In the News. If you like it, please share it. I will see you back here in the new year. Have a happy and a healthy start to your 2024. I'm Stacey Sims. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.